I would like to talk about some of the basics of ECG. So first I would like to talk about the basics of ECG. One large square is 5 mm and one small square is of 1 mm. So the speed of the paper is 0.04 per second and the speed or the duration of one large box is 0.2 second. So if the speed of the paper is more, right, the QRS complexes will be very widely spaced. So it will look like braiding. If the speed of the paper is less, then the QRS complex will be very closely spaced. So it is very important to check the speed of the paper or to check for the standardization of an ECG. The amplitude, the 1 millivolt will produce 10 mm deflection in an ECG. So that is standardization. So as I have spoken earlier about the standard calibration, the paper speed is about 25 mm per second and voltage, that is y-axis, is 0.1 millivolt per mm. So the normal ECG consists of P wave, QRS complex, T wave and the ST segment. So P wave represents atrial depolarization. The PR interval is the time taken from the SA node to the AV node or to the initiation of stimulation of the ventricles, right? So if there is AV nodal delay, right, so the PR interval will get prolonged. In case of heart blocks, the PR interval will be prolonged. The QRS complex represents the ventricular depolarization and the ST segment T wave are produced by the ventricular repolarization. So, as described earlier, the waveforms, P wave is atrial depolarization, QRS complex is ventricular depolarization, and ST segment T wave and sometimes U wave may be present, that is ventricular repolarization. So there are segments and intervals. So segment is defined as portions of the ECG bracketed by the end of one waveform and the beginning of the other. So there are three basic segments, that is PR segment, ST segment and TP segment. The intervals of ECG include at least one entire waveform. There are four set of intervals, that is PR interval, QRS interval, QT interval and RR interval. So normally at rest, P wave in every lead is less than 2.5 mm, that is 2.5 small boxes in amplitude, and less than 0.12 second or 3 small boxes in width. So it should be less than 3 small boxes in width and 2.5 small boxes in height for to be called as a normal P wave. So normal QRS complex is about less than 0.1 second, or it should be smaller than the 2.5 small squares. ST segment. ST segment represents the earliest phase of ventricular repolarization. The normal ST segment is usually isoelectric, but it may be slightly elevated or not depressed normally. Usually, the elevation or depression which is considered normal is less than 1 mm. The U wave is a small rounded deflection sometimes seen after the T wave whose exact significance is not known. Functionally, U wave represents the last phase of ventricular repolarization. Prominent U waves are characteristic of hypokalemia. So inferior wall MI, ST segments depression or elevation we see in 2-3 AVL. Lateral wall MI is seen in 1 and AVL. And V5, V6, that is left lateral leads. Anterior MI is V3, V4, and septal MI is V1 and V2. I'll be talking in detail about in the subsequent lectures, but this is just a summary of it in this slide. So the normal axis is from -30 to +110. So left axis deviation is from -30 to -90. The causes are past inferior MI, left anterior fascicular block, ventricular pacing, emphysema, hyperkalemia, WPW, tricuspid atresia, and ostium primum ASD. The causes of right axis deviation, which is from +110 to 180 degrees, is normal in kids, left ventricular hypertrophy, COPD, previous anterior MI, pulmonary embolism, ASD or VSD, dextrocardia, pectus excavator, left-sided accessory pathway in case of WPW syndrome, left posterior fascicular block, reverse arm leads. In right axis, extreme right axis deviation is seen in case of emphysema, hyperkalemia, lead transposition, ventricular pacing.